Hello and welcome. My name is Bill Sykes. I'm the ATDA Secretary Treasurer. That's the American Train Dispatchers Association. And we are currently making this video series for people who are interested in possibly unionizing with us as your representation. And the idea is that we're going to take frequently asked questions, topics of interest and concern, and provide you with straightforward answers, just concise, factual-based responses to these questions. And in this video, we're going to discuss the Railroad Employees National Health and Welfare Plan to give you an idea if you're like a Class 1 railroad employee and you unionize with the ATDA, what is your health insurance probably going to look like? To discuss this plan, I brought someone who has a lot of experience and expertise on the subject. That's ATDA Vice President Brandon DiNucci. So Brandon, welcome. And how are you today?
Doing great, Bill. Thanks for having me.
It's good to hear it, buddy, and no problem at all. I know you'll be able to provide some great answers here. The first one I have for you is the one that we get. Railroad Employees National Health and Welfare Plan covers the Class 1 ATDA members. What's included in the plan?
Sure. So the plan actually contains five major benefits that make up the plan. And that's your major medical health insurance, which is what most people would associate health insurance with being. Right. There's a prescription drug benefit plan. It also includes dental, vision, and life insurance as well. And it does cover, as you say, our Class 1 members, but it also does cover some members on some other properties as well.
And I know if somebody's watching this, it's because they're at some corporate railroad and most likely, and they're used to dealing with the corporation dictating to them what their health care is going to be. This plan is not like that. Can you kind of explain how it's managed and how that differs from what they're probably used to?
Sure. The plan is very unique in that it's an entirely self-funded plan. And what that means is, most people are familiar with purchasing auto insurance. And you go to State Farm or Allstate or Geico and say, hey, I want coverage. And they will tell you what type of coverage that they are willing to give you and how much it costs. And you really don't have any say-so in that. With a completely self-funded plan, there are two parties that are signatory to the plan, and that's rail labor and the rail carriers. And then ATDA, of course, being part of rail labor, the two parties meet and they determine what the cost of the plan will be based on the utilization. And so what that means is the amount of utilization for the plan drives the actual cost. So once annually, the parties will meet, usually later in the year, and take a look at the finances of the plan, meet certain fiduciary responsibilities, and then they will determine what the monthly premium will be for the following year. Something that's very unique about that plan is that the insurance companies, even though we work with United Healthcare, Aetna, and Highmark, they do not dictate to us what the plan will be as far as benefits or the cost. That is completely driven through collective bargaining.
So in other words, ATDA members, they actually have representatives at that table as these numbers are being determined to kind of keep an eye on things and make sure that the members are represented properly.
Absolutely. President Dow is one of the rail chiefs, and all the rail unions that are part of the healthcare plan are there, as well as the carrier representatives as well.
Awesome. Well, it definitely sounds great. And I'm sure that some people watching this are like, okay, great. I've got representatives at the table, but does this actually work? And does it result in a better deal? So that's my next question is, what is the monthly cost share currently? And is that kind of rising like every other healthcare plan in the country right now?
So presently today, we're going to record this video here at the end of 2024. Our members are paying 15% of the overall monthly premium. So the monthly premium, as I said, is set by the joint policy holders, which is rail labor and the carriers. And then the employee will pay 15% of the cost, while the carriers will pay 85% of the cost. Now, as I said, currently it's 309 and change, but going into 2025, something that's very unique is we're going to continue to pay the 15%, but that price is going to go down. So beginning in 2025, members will pay $277.54 a month. And that's for all members, regardless if the individuals only cover themselves, their self and their spouse, or potentially, 4 or 5 children and their spouse. Something that's very unique, and that we try to level set the monthly cost share for everyone, because we're trying to make sure that everyone can benefit from the collective bargaining.
Well, that's amazing, and I actually know that, but I'm just still excited about it, and I hope prospective members will be too. So $277.54, you can do that as a single person, you can do that as a family of 5 or 6 or whatever. and that's kind of expressive of the ideals of our unions to provide a good benefit for everyone. Now, there's more to it than that, and you know, and I know, and the people watching this know that there's often kind of like a catch with insurance. So, what about the co-insurance? How is that set up? Because that's another factor.
Sure, and that's probably the biggest factor with insurance plans. Our plan is set up as a 90-10 plan. So the co-insurance, 90% of it is picked up by the plan, 10% of it is picked up by the member, of course, until they reach their out-of-pocket maximum. Now, where that differs is a lot of corporations today, you're seeing 85-15 plans or even 80-20 plans, which 5 or 10% doesn't sound like much, but when you're talking about a significant medical bill with potentially high deductibles or high out-of-pocket maximums, that can really add up for employees and members. So, a 90-10 plan is pretty unique in this market in this day and age.
Yeah, definitely. All right, so let's talk about deductibles. I mean, you hear crazy things these days all over the country. Some are five figures. I mean, what are the deductibles for this plan that we're discussing, the Railroad Employees National Health and Welfare Plan?
Sure. The deductibles are currently $350 per individual or $700 per family. And that deductible, as well as the co-insurance and the other numbers that we're going to talk about as far as the out-of-pocket maximums and so on and so forth, that again is all set through collective bargaining, and those numbers are locked in through our agreement.
And next step on that, maximum out-of-pocket per year. That's another place that they tend to get you sometimes.
Sure. So the maximum out of pocket that someone will pay per individual is $2,000. For a family, that's $4,000. So once you hit that out of pocket maximum, that's it. That's all that you're paying out of pocket.
Right. And just to recap so far, just to get straight to the numbers, we're talking about a $277.54 per month, starting January 1st of 2025. It's a 90-10 plan. The deductible is low at $700 for family, $350 for an individual, and the max out of pocket, you said, was $2,000 for individuals, $4,000 for a family. Is that right?
Correct.
Okay. Now, that's great. But, one of the things that you hear asked is, okay, well, fine, I got good insurance for a while, but you hit a cap. Like, is there a lifetime maximum benefit to be capitalized upon?
No, under our plan, there is no lifetime maximum.
And what about prescriptions? Because that's something that hits people hard.
And the one thing that we're seeing with some other plans that are out there, many times a prescription drug benefit is categorized where drugs are either put in a tier system or tier 1, tier 2, tier 3. And what's really confusing to the employee or the member is that generic drugs may be in tier 1 or they may be in tier 2, and that becomes extremely confusing. But with our prescription drug benefit plan, it's broken down into 3 categories: generic, brand formulary, and brand non-formulary. For generic, it's $10. For the brand formulary prescriptions, $30, and for the non-formulary prescriptions, it is $60.
My understanding is the non-formulary, like there's sometimes like where there's a name brand and another name brand, and one might not be on the list. And occasionally a doctor will say, well, I really want this name brand. And so there's a chance that you might have a 60, but it's usually 10 or 30.
Correct.
This is really a premium plan. And one of the things that we're both very excited about, we announced to our members recently, was the addition of a new benefit. And we keep getting those in every contract, as people will see as they read these new agreements we're reaching. But we have the new Centers of Excellence. We've done a separate video on that already. It's going to be on our website. Briefly, can you just give them the basics on what the Centers of Excellence are and why they're a great new benefit?
Sure. Under our plan, we have 2 types of centers of excellence. One is a cardiac center of excellence, and the other is a musculoskeletal center of excellence. The main thing for our members to understand is that when they utilize a center of excellence for musculoskeletal, whether that be a rotator cuff surgery, hip replacement, or spinal surgery, or through the cardiac center of excellence, all of those benefits, the surgery and everything, is covered at 100% cost. And what that means is all those numbers that we went over as far as out-of-pocket maximums, deductibles, co-insurance, those don't apply. The member literally pays nothing, and they receive world-class, top-notch service through the top 1% of surgeons and facilities in the country. Not only does that provide the actual surgery at no cost, but in many cases, a member may have to travel to one of these facilities or to see one of these surgeons, and the travel is actually covered as part of this benefit. It's unbelievable. So if they have to have a plane ticket or perhaps drive a couple hours to get there, that's all covered by the plan. Also, it will cover for a family member to travel with the individual put them up in a hotel, provide a stipend for meals, and that's all covered 100%.
That's incredible. Why? And I just did this off the cuff while you were saying that. I Googled this because the Cleveland Clinic for cardiac treatment, US News and World Report for 2023 and 2024 named them the #1 heart hospital in the United States.
Right. And like I said, not all our members are located just down the street from the Cleveland Clinic. We have members in all four corners of the United States, either way, all the way up in Alaska. But the members who are covered by this plan and utilize this service will actually be provided transportation to Cleveland, Ohio, put up in a hotel. Their meals paid for and the surgery all paid for as part of this plan.
Yeah, so you're talking about a benefit that just kind of is a cherry on the top, but think about it, guys. I mean, there's going to be members out there and railroaders that have these issues, and so we want to provide great care for our members, and we believe this plan does this. But I'm just excited about it. The last question, this kind of begs the last question: how did we get such great health care?
Well, I mean, that's a good question, but I mean, it simply boils down to, years and years of collective bargaining. Those who have come before us negotiated for these benefits, fought hard for these benefits, and we continue to fight hard to keep these benefits. And, the great thing about this is that all of these benefits and all of the plan structure is all guaranteed through collective bargaining. And so that means that there is a legally enforceable document that says, hey, our co-insurance is going to remain at 90/10. Deductible is going to remain the same. That is one of the great things about having a collective bargaining agreement, because as we all know, when you don't have that guarantee, your employer, next week, next month, or next year may completely change your benefit structure. And, that creates all kinds of issues for employees or members and adds all kinds of outside costs. So having this, guaranteed in writing is a huge benefit to our
Yeah,
members.
that's one of the things I tell people. I'm like, don't trust corporate promises. Get it in writing with a collective bargaining agreement. And I know we're both longtime union railroaders, and I've been a member of the ATDA for going on 20 years now. I know what it's meant to my family, and I believe in the cause. And I know that there's those of you out there watching this that are like, I wonder if they can help me. And the answer is yes. But the facts need to speak for themselves. And so that we're going to keep it at that. And if you would like more information, we know this is a big decision for you. Just want to help inform you. You can check out other topics and other videos like this and get other reference information at our organizing website. That's atdanow.org. That's atdanow.org. Maybe you just want to talk to a human, just want to kind of express concerns, just find out what we're all about in person. You can email me, info@atda.org. That's info@atda.org. Would love to hear from you and help you in any way we can. So, Brandon, any last words before we sign off here?
No, I think you covered it, Bill. Thanks for inviting me to speak, and look forward to putting some more of these videos together.
All right. Well, everybody out there, on behalf of Brandon and myself and the members of the ATDA, we encourage you, keep digging, keep researching, and let us know how we can help. And we'll look forward to hearing from you.